For your operatory skill assessment, you will need a burrito. Within the burrito contains all items necessary for PPE, infection control, and patient treatment. When you enter the operatory to begin setup, you should be wearing your lab coat. You will first begin by washing your hands for 40 to 60 seconds per who. Once your hands are clean and dry, enter the operatory and remove the water bottle with clean hands. Avoid touching and contaminating the blue tubing. Fill the water bottle with distilled water and return to the unit to reattach the bottle. And again, do not contaminate the blue tubing. Now we will prepare to set up the room. You will begin with sanitizing your hands per who, 20 to 30 seconds. Apply your goggles, face mask, and gloves. Now that you are wearing all appropriate PPE, you will start by wiping all surfaces of the room in a systematic manner with a cavi wipe. Use new wipes as needed because the wipe should be saturated enough so that the surface being disinfected may remain wet for 2 minutes. All surfaces of the room should be disinfected. This includes dental light handles, poles, bases of the chair, leather portions of the chair and stool, cabinets, countertops, air water syringe, saliva ejectors, hand pieces, all cords and holders of the bracket table, flags, wall pocket holders, and additional items such as pens, pencils, computer mouse, clipboards, hand mirror, and patient eyewear. Once the room is disinfected, turn on the master switch of the unit and flush the air water syringe for 2 minutes at the beginning of the day and 30 seconds in between patients. Now that the room is completely disinfected, remove your gloves, goggles, and mask, and place the mask and goggles on a clean paper towel or tray cover. Sanitize your hands. To prepare the operatory for patient treatment, we will need to apply barriers for proper infection control. Apply the barriers with clean, bare hands to all of the following items. The chair buttons, light switch, mouse, and chair lever should all be covered with a piece of blue tape. The remaining barriers can be found within the contents of the burrito. This includes light handles, patient chair, keyboard, bracket tray, air water syringe, and suction. Prepare your overgloves at the computer workstation for use as well. Now that all barriers have been placed within the room, sanitize your hands per who and gather the remaining supplies needed for the appointment. This may include an instrument cassette, handpiece, ultrasonic insert, prophy angle, and prophy paste. Prepare for your patient by lowering the chair, removing the rheostat, and adjusting the light. You are now ready to bring your patient back from the waiting room and proceed with medical history and vitals. Once you have seated your patient, wash your hands per who and put on gloves to unwrap your sterile cassette. Prepare your bracket tray for treatment and dispose of the wrap and packages. Remove your gloves and sanitize your hands. Place the bib on the patient and then get permission to proceed from your CI. Once you have been given PTP, you will now put on your remaining PPE. Place your gown over your scrubs and then place on your protective eyewear and mask. Now you will wash your hands per who and apply your treatment gloves. After treatment is complete and before walking the patient out of the clinic, you will need to remove your treatment gloves. Discard of the gloves and wash your hands thoroughly and then dry. Remove your eyewear by touching only the ear rest and place the eyewear on a disposable towel for proper cleaning and disinfecting. Next, remove the mask by sliding the fingers on each hand under the elastic strap and discard of the mask. Lastly, you will remove the gown by carefully untying and removing it without touching the outside, contaminated portion of the gown and hang the gown in the unit inside out. Wash your hands and walk patient out of the clinic. When you return to the room, you will need to disinfect and clean the area. Replace your gown, goggles, a clean mask, and put on your utility gloves. You will want to remove trash from the cassette, inspect and organize all of your instruments, and then place on a transportation tray. The cassette is open and spray the instruments thoroughly with Pro-EZ foaming enzymatic spray. Ensure that the instruments are positioned correctly and the cassette is closed and locked before transporting the tray to the sterilization area. When you transport your cassette into the sterilization room, you will load it immediately into the hydrum, and if it is unavailable to load, you will place it in the cabinet in the container labeled "Needs to go into hydrum." Remove the barrier from your tray and place it into the trash bin in the sterilization area and return the tray to your operatory for disinfection. When you return to your operatory, collect all barriers and load onto bracket tray barrier. Once this is full, pull bag up and dispose of the bag into the trash. You will now wash your utility gloves with soap and water, dry them, and disinfect them with a cavi wipe, and hang them in your unit to dry. Now you will remove your gown, turn it inside out and throw it away, wash your hands, don your lab coat and a new pair of gloves. Clean and disinfect the room along with any other compromised items such as the transport tray and Pro Easy spray bottle using the exact same wipe technique used previously. Once the room is disinfected, you will need to flush the air water syringe and Cavitron if used for 30 seconds between patients. Collect and secure your operatory trash and take to the designated area. Dispose of your gloves in this trash can. Return to your unit and place on a new pair of gloves and replace the trash can liner. Place the trash can under the sink and dispose of your treatment gloves. Remove your mask and goggles and wash the goggles with soap and water and lay on a paper towel to dry. Wash your hands per who and the room should be adjusted to its original layout, so place the bracket tray in its original place, raise the chair, and adjust the light. Then place the rheostat back on the end of the chair. This will complete the hand washing PPE and operatory skill assessment.